My name is Charles Alessi, and I'm the Chief Clinical Officer for HIMSS. And I'm delighted to have two people to have a conversation with today, Tim Kelsey and Anne Snowden, both of whom are really old friends. So I'm going to ask them to introduce themselves. Let's start with you, Anne.
Thank you so much, Charles. I'm a professor of strategy and entrepreneurship at the Odette School of Business in Canada. I'm a nurse by training, and I'm also the director of research for HIMSS Analytics.
And thanks, Charles. Yeah, my name is Tim Kelsey. I'm the Senior Vice President for Analytics internationally. I was before that Chief Executive of the Australian Digital Health Agency. And before that, I was the National Director for Patients and Information in NHS England.
Thank you. So we don't have much time, so let's use it because we have a really exciting subject to talk about today, and it's the digital health indicators. Anne, would you like to introduce this to us?
Absolutely. If I can go to the first slide, please. The digital health ecosystem is really the framework underneath why we developed the digital HIMSS health indicator, which I'll describe today. If you go to the next slide, please. There were early on some very important signals that healthcare systems globally have not been achieving all of the outcomes of their mandate, really, which is to keep citizens healthy and well. Medical error is just one of those examples. It is the third leading cause of death in North America. Very similar data across other global systems would suggest how is it that health systems have and cause harm at a rate of third leading cause of death. So that's one signal that health systems really needed to think about a transformative agenda. Next slide, please. The second is what we often refer to as personalized medicine, or in some cases, what we could say in precision medicine. This is a graphic that was published just a year or two ago, and it really demonstrates the 10 most commonly prescribed drugs in the US population. These drugs are relatively similar in other jurisdictions, often under different names. But in this graphic, you'll notice red people and blue people. The red people for each of these drugs is the relative number of people when prescribed that drug actually achieve value. The blue people is the relative number who actually either achieve no value for that drug or actually may experience harm. But here's the catch. There are few, if any, global health systems that have the digital infrastructure that can distinguish exactly who are the red people that we are delivering care for, who should be receiving these drugs because they do achieve value. And just as importantly, if not more so, who are those blue people who get no harm but probably spend significant money in terms of those prescribed drugs and or may experience harm, which cause significant challenges or errors, as we've seen a moment ago, as a result of taking drugs. So that's a second very significant issue that has been building over a number of years in global health systems. The third is on the next slide, is the whole issue of the empowered consumer. Consumers today in virtually every country and jurisdiction in the world live by and large in digital societies. We go to school online, we bank online, we book our travel online, but healthcare and healthcare delivery models have not been as digitally enabled as virtually every other business sector. Next slide. And then along comes what we are all now experiencing today is the COVID-19 pandemic. As one physician leader shared with me recently, he said, Anne, we are flying blind. Same idea, you get the pattern across these challenges. We are seeing massive surge in demand for care. We have relatively limited capacity to scale quickly, and we saw that in both Italy and New York City, among others. We have at least 90,000 health workers infected by COVID-19. We actually don't know who got infected, how, and why, and those who didn't. We have product shortages, PPE being just one of them, and a sudden and rapid shift to virtual care because there's no other way to offer care to patients in the very challenging time of a pandemic. So when you think about all of those key indicators, health system transformation to a much more digitally enabled system, all is becoming very, very important. If you go to the next slide, I'll talk about what that actually means. So no question, digital health is viewed as an opportunity to optimize health system performance and achieve financial sustainability. If we could track and trace every individual patient and know who achieves value from those therapies, think of those drugs we just mentioned prescribed in the US, or which particular medical devices work well, we could actually not only achieve quality safety, we'd also achieve financial cost savings. However, when we talk about digital health, there's relatively little evidence in the literature in terms of what does it actually mean? What do we mean by digital health? What's a standard definition? There isn't one. What's a roadmap to actually get to a more digitally enabled health system? There wasn't one when we started this digital health indicator design and development. So if you go to the next slide, I'll touch on a few dimensions of the building blocks of a digital health ecosystem. These are all identified in various publications in the research literature, and of course the great literature, white papers, and so on. At the basis of this system must be strong governance and a workforce enabled to deliver digitally enabled care and work in environments where data is mobilized so they know what a patient's received in terms of care, has it worked or hasn't it, and how best can we make sure every patient gets access to best care possible. That's about data stewardship, making sure privacy and security is maintained, and supporting the workforce integrity, which is foundational to that system. Democratization of data. It's all about the exchange and movement and flow of data from clinician teams to patients so that as a patient you know exactly how you are progressing towards your health goals and you're easily enabled to connect to your care teams and help them when and where and if you start to not make the progress you would anticipate making. All that democratization of data is fantastic, but if you don't have the analytics to make sense of it and identify outcomes, not only at an individual level, but at a population level, and you have the data infrastructure for traceability, that's when you actually move towards a digitally enabled ecosystem where patients, citizens, consumers, however you describe them, are meaningfully connected to their provider teams when and where it's needed, so people are able to help themselves, help them manage their health and wellness, stay healthy and well, and that drives population health and wellness overall. Next slide. How do you measure it? If you can't measure your digital capacity, then how could it possibly be a health system can transform their digital health ecosystem environment? That's the basis for developing the digital health indicator. It is simply a measure of the ability of a health system to have the capacity to deliver digitally enabled care. That does not mean that every care provided procedure or engagement or visit is digitally required online. It means that digital environments, digital infrastructure mobilize that data, analyze that data right at the point of care for both patients and their clinician teams, and that informs decisions on how do I stay healthy and well in a secure and private environment, how do I connect to my clinician teams, and what outcomes am I achieving, what outcomes is the health system achieving in terms of their performance, quality, safety, cost, and even sustainability. So the health indicator tool is a one-time measurement of a capacity of a health system to drive towards that digital health ecosystem. Next slide. What are the kinds of things the DHI actually measures? Well, it's organized into 4 dimensions. Interoperability, we just talked about that mobilization of data, the democratization, so that all of the key stakeholders actually have access to the data they need to make decisions and inform decisions. So whether it's clinicians' use of secure tools, or it's the security alerts that are helping us avoid risk and stay healthy and well by getting cued right at the point of care, or just the adoption of digital tools. Those are the kinds of things that DHI would measure. Person-enabled health, that's the degree to which a person is able to and has the tools and the support and connectivity with provider teams to manage their health and wellness. How effectively is the system able to generate proactive alerts to reduce risk when someone's health is starting to not progress or not be maintained, and they are threatened by things like what we're seeing today, the COVID-19 pandemic, or any other chronic illness outcome. Population health is also critically important. It's not just about tailored, personalized care pathways for every individual. It's segmenting populations, able to identify which of our population groups is doing exceptionally well, what are the conditions under which those great outcomes have been achieved, and how does that teach or help a system learn how to achieve those best outcomes for all of their population segments, whether those populations are specialized groups with social determinants of health, or they're unique populations in a particular jurisdiction. Analytics, of course, mobilizes data, identifies outcomes and progress towards health goals, and of course, governance and workforce or organizational policies. The degree of transparency across a health system, how are incentives and funding models contributing to that digital health ecosystem progress, and what are the accountability tools that help and support workforce capacity and competencies to deliver digitally enabled care. Next slide. The digital health indicator, of course, builds on the maturity tools with HIMSS. HIMSS has 7 maturity tools, and each one of them comes together in very unique combinations to advance each of the 4 dimensions of a digital health indicator. As a health system measured their digital health indicator score, you'd get a detailed review of each of those 4 dimensions. That would help you identify which combination of the maturity tools would help do a much deeper dive, provide that digital roadmap to improve upon one or more of the dimensions of digital health. Next slide. Here's a quick graphic of what are all the 7 maturity tools actually measuring. AMAM is the analytics maturity, which is a very deep dive on advancing not only the mobilization of data, but analyzing that data to create knowledge and evidence right at the point of care in real time. INFRAM is the infrastructure model, which allows for and supports interoperability. Many of you know MRAM, that electronic medical record, and its sister model, the OMRAM, for outpatient care. CSOM is the latest maturity tool. That's the clinically integrated outcomes supply model, very much focused on supply chain and how it's automated and digitally enabled across the journey of care. DIAM is the digital imaging model, and continuity of care model is CCMM. Next slide. And Charles, back to you in terms of where and how a digital health ecosystem could advance.
Thank you, Anne. I'll come back to you after I bring Tim in, because Tim, we heard a description of the digital health indicators, and I mean it is a wonderful description of a system which basically captures all the things which we're all concerned about, which we all know could work better. And really, let's think in terms of its application. In other words, its deployment. So, given you've heard, I mean, why would anybody, how do you talk to governments around adopting something like this? What arguments do you put forward for people to really start taking this more seriously?
Well, thanks, Charles, and thanks, Anne. There are governments and regions, states around the world who are already engaged with the digital health indicator. There have been trials now run in a number of areas: Denmark, Australia, Canada, the US, and other countries are now looking at either national or regional implementations. And the reason that they are doing so, I think does, and we may as well explore this perhaps in the framing that the digital health indicator itself gives, the 4 domains. The first domain, interoperability. governments around the world have struggled for many years with introducing means by which people can, at the front line of care delivery, are able to share information with common meaning. And probably the biggest cause of medical error and misadventure is the absence of shared information with common meaning. In other words, people either not having access to key clinical information or having access to the wrong clinical information. And although that may seem counterintuitive, that is a very routine occurrence and very sadly does on occasion lead to great tragedy. We had an incident in Australia where I'm speaking from today, not that long ago, I'm afraid all too frequently now, where a coroner concluded that a person had died unnecessarily because a piece of medical information was faxed to the wrong number. And so the enemy of clinical safety in many cases is this failure of interoperability. And that's been a very big focus for governments around the world, driving them to really want to understand the digital maturity, not just of their hospitals, but of their out of hospital environments as well. So the whole system, and that's what the digital health indicator provides, is a framing for the whole ecosystem of healthcare. And that's, I think, what makes it unique and very valuable.
Thank you. Anne, I'm going to, I think that's a very good response. And I'm going to come back to you with this question, Tim, after I ask it of Anne, because, you know, we've heard from both of you now how important it is to introduce a system like a digital health indicator into a health and care system, because clearly the balance has shifted to harm perhaps being more predominant in some cases, and the advantages are enormous. I understand that, but I'm going to take you to a different place. I am now the chief executive of a large provider of care, and the thought of introducing something which is going to upset people, because inevitably change always upsets people, because it's different to what they've always done. So really the question is it worth it? Because is it worth introducing these systems? What advantages do they give you if you introduce these systems? What advantages would systems that actually have higher levels of maturity in terms of digital transformation have over others which have lower levels of maturity? I'm going to ask you that as well, Tim. So Anne, over to you.
Yeah, that's a terrific question. And I think in a pandemic like we find ourselves, it is very much about how do we now transform our systems to be better prepared? Should there be a next phase or even a next pandemic? The very strong theme I keep hearing over and over again is never again. And we've seen this in other phases of very significant challenges. We saw it in 9/11, changed the entire travel industry, and they never went back to the pre-9/11 travel security systems that we've all become very used to. The other, I think, dimension here is don't underestimate the consumers. It has now, for the non-COVID-19 patients, they're very used to virtual care. They can go online, they don't have to leave home or stop what they're doing. They can see their practitioner on that virtual screen, get exactly what they need. Same with their pharmacist, same with all their other care providers. Do you really think they're going to want to go back? So if it were me really talking to that chief executive officer, one thing would be, look at where your citizens are and how quickly they adopted that virtual tool. Countless individuals have said, wow, I'm never going back. I'm not doing the in-person, find a parking place, call and make sure I have an appointment. It's become very convenient. Secondly, is how does digital transformation solve the never again challenge? If we get to that point and find ourselves in another pandemic and continue to have to hunt worldwide for an N95 mask, that would suggest to me that no CEO, no C-suite executive wants to go through that again. Digitally enabled supply outcomes with MRAM, infrastructure interoperability, person enabled, you would know exactly where every patient is in your system, what provider team is on site, what care they've delivered, what outcomes they're achieving, and oh, by the way, how many days of inventory of PPE do we have? I cannot imagine a system that doesn't strive for making sure we don't ever find ourselves in the position that they're clearly struggling with today. Some jurisdictions, mind you, more than others, but the gravity is exceptional.
Wow, what you describe is a health and care system with mirrors,
Yes,
open
it
windows,
is.
and
Yep.
transparency. They exist.
Imagine.
Just imagine that. So, Tim,
Exactly.
what do you feel about this?
Well, I feel a little bit as well, and this kind of it's a little. There's a little bit of Groundhog Day in this. Let's be honest. And these things come in waves. I mean, you'll remember, Charles, that 20 years ago now, I set up a company called Dr. Foster, which was all about promoting transparency in English healthcare, and we published, data on mortality outcomes for English hospitals, and it was regarded as a very transforming moment. I think quite a disruptive moment by many of the clinical leaders in the English NHS at the time. And now we're still talking about the importance of transparency, and the honest truth is that that level of transparency isn't the case in most countries in the world currently. So I think we need to be mindful of our history, of our experience, which is these things take a long time to deliver. But equally now with this pandemic, of the incredible, the way in which, I suppose you say, you're right to use the concept of analogy of mirrors, the way in which we are now so aware of the implications of failure to deliver. And I just wanted to reflect that I think if I was speaking to the chief executive, and in fact I do this all the time, so I'm constantly speaking to chief executives about the importance of digital maturity, and whether they're government ministers or system chief executives, this is my kind of, my narrative is that the digital opportunity is not a silo. It's not on its own. It's part of an enabling infrastructure like workforce for improving health services as a whole. And the key drivers for the wish to improve your health service, to continuously improve your health service, obviously related to all the things we've discussed, is because you want it to be as high quality as possible. So there's a very simple clinical driver, which is how can you support clinicians to make the best decisions possible? And that's not about having robots replacing doctors. Let's forget about that altogether. This is about human clinicians being supported with decision making in a very complex clinical environment, much more effectively using judiciously and with care certain sort of digital algorithms, digital data, and digital tools. So that's the clinical imperative. The second imperative is the social imperative. It's recognizing, as Anne says, that in every other part of our lives, we, the consumer, has become a great deal more active. And the net result of which is we have taken on more of the administrative work for our banks and our travel agents and so on. But we are happy because we are much more empowered. We can access those services much more conveniently. And interestingly, those services, the quality of those services has also improved. And the airlines industry is a really good example of that, where in fact costs have significantly reduced, and this is obviously pre-COVID and the lockdown, whilst quality and the number of deaths lost in flight have almost evaporated to virtually nothing. So a really good example for healthcare. So there's that social imperative, recognizing the power of me as the core focal point for healthcare. Then of course you've got the third driver, Mr. Chief Executive or Mrs. Chief Executive, and that is the economic imperative, which is very real, particularly in the United States, where of course universal healthcare is not a political commitment. But in the United States, where fee-for-service is the overriding principle of healthcare delivery, obviously there are some exceptions with Medicare and Medicaid to that, we've seen costs inflate to the point where they are going to be absolutely unsustainable in the course of our lifetimes, unless very significant efficiency is found in the way in which healthcare in that country and in many others is administered. But I'd like to dwell just very quickly, finally, on what I think is the most important imperative behind digital health as an enabler of overall improvements in outcomes, and that's the human imperative. And I just reflect on the fact that many people have experienced tragedy during the course of this pandemic. I have one friend whose mother died in an aged care facility. She was taken to an acute, or rather she was taken sick in an aged care facility, taken to hospital. Her daughter wasn't able to see her before she died. She died and there was no funeral, and that was the end of that of that lady's life in the most tragic circumstances on every front. And obviously, the grieving process for her family made much more complex and difficult by the absence of their presence during the actual final moments of their mother. And I reflect on the fact that when the pandemic is helping us to very rapidly realize where we have our greatest vulnerabilities. And one reason I think, above all, that a chief executive of a country or a health service will want to address themselves very urgently to the digital opportunity is because just aged care, just being able to improve the outcomes and safety of our oldest, most vulnerable populations in their in the final years of their lives. And what we've seen around the world is the pandemic exposing our weakness in the treatment and care and safety of elderly people. So I just think that on its own is enough. Just helping people at the end of their lives is enough of a driver for us to be taking digital health very seriously, and to be looking to the digital health indicator to help us understand how we can improve, what roadmap we need to be on to get to the point at which we are genuinely delivering safe care for people in those circumstances.
Thank you, Tim. And really, we could go on for the next hour in terms of having a conversation about this, because it's one of the richest subjects that exists. But it's abundantly clear that in the world today, and even more in the world of the future, it will be very difficult for health and care systems to survive without digital transformation for a whole variety of reasons, a lot of which we talked about today. And it would be very difficult for a system to actually go on that journey of digital transformation without doing it in the best and most optimal way possible for their geography and for their circumstances. And the digital health indicator clearly is I think, the most ideal route to get there. So thank you both and our audience for joining this educational discussion. Would like also to thank the healthcare professionals for continuing to fight on the front lines. We're already going through an exacerbation of this pandemic, and no doubt there will be more battles. But the work that you have done and the bravery that you have shown us all is something we really are all very, very proud of. Thank you very much for your attendance, and I hope you enjoyed this session.